Good afternoon, and thank you for agreeing to participate in my discussion on the swine flu. Today we're going to discuss what the swine flu is, how it spreads, the signs and symptoms of the swine flu, and when to seek medical attention as an addition to prevention and treatment of the illness. So, the swine flu, is it really a world pandemic or just another strain of the flu? Originally, the swine flu was isolated in pigs mostly of North America, and that's where the swine part of the flu came from. Since then, other studies have taken place, and it is shown that while the genes are similar to that first isolated in the pig, the flu or the influenza virus that is found in the humans is just a little bit different. So we've moved away from calling it the swine flu, and it is now more commonly referred to as the H1N1 influenza virus, or the 2009 H1N1 virus. So we're moving away from the swine flu and into this more just cause or just a smooth flow of another season with another swine flu. How does the swine flu spread? Well, the swine flu is said to spread just like any other flu or virus out there. It is spread through contact with someone who may have the flu virus. This is done by coughing or sneezing, and you inhale the droplets from that individual, or it can be contacted through touching a surface that already has the swine flu on it. If you go to a bar, if you go to a museum and you touch something that somebody else has already touched who is infected with the virus that may have coughed on their hand and touched this particular thing, you may get the virus that way. It can also spread from animals to humans. This is for the population of farmers or people who work at the zoo or may work at some type of place where animals, just like humans, suffer from the flu virus. In this instance, again, we just ask that you practice, or the CDC just asks that you practice preventive measures, such as putting on protective equipment. Recognizing the signs and symptoms of the swine flu. Signs and symptoms of the H1N1 virus or the swine flu is very similar to that of any other virus or flu, and it includes fevers, chills, body aches, a little bit of nausea. Most of the time you will not have vomiting, but sometimes it is reported along with diarrhea. It is important that you know most people do recover from the influenza virus without hospitalization. However, people who require hospitalization are usually in the at-risk category. When I say at-risk, I mean people who are more likely than others to catch the influenza virus in a more severe form. This population includes adults ages 65 years or older. Then you'll have the children ages 5 years or younger, your pregnant women, and then individuals who are said to have chronic illnesses. When I say chronic illnesses, I'm talking about lung disease, heart disease, kidney disease, or any other type of disease that may lower the immune system. When should I seek medical attention? Medical attention is sought out whenever you have difficulty breathing. No matter what you do, you just can't seem to catch your breath. Any pain or pressure that is different from any other that just won't go away no matter what you do or what you take, you should seek out medical attention. That in infants, if you notice that the infants are not taking as much bottles as they used to or not as active and playful as they used to, you should go ahead and bring the infant to the hospital so that you can find out what the problem is. It may or may not be the flu, but this is an instance where you really don't want to wait because the infants are in that at-risk population. Let's talk about prevention and treatment of this disease or this virus. Much like anything else, in this season we recommend, or the CDC recommends, number one, vaccination against the flu. That's your number one offense for the H1N1 virus, is obtaining the vaccination. Secondly is practicing good hand washing hygiene. after coming in contact with any surfaces or any individuals that you can't really rule out illnesses from, you should go ahead and wash your hands before you eat, wash your hands before touching your face or picking up a baby. Similar to the things you would do if you weren't worried about the influenza virus. And thirdly, to prevent the spread of the H1N1 virus, you should follow recommendations of your physician. Some physicians will say, I recommend that you don't take the vaccine because of XYZ. Whatever those reasons are, whatever your physician recommends that you do, it is the Center for Disease Control's recommendation that you follow. Follow what your physician says. We've talked about what the swine flu is. I've told you how it spreads. We've talked about the signs and symptoms and when to seek out medical attention. I hope that in covering this, I've enlightened you with the necessary tools to prevent the spread of this H1N1 virus. Again, the idea of this speech or this discussion was to let you know that the H1N1 virus is just like any other virus out there. Let's not get caught up in the hype of the pandemic or the pandemonium of the swine flu. And let's do what we can to prevent the spread of this disease. The take-home message here is vaccination, good hand washing, and also doing what your primary care physician recommends you do. If you come in contact with the animals, say a farmhand or somebody like that, make sure you wear protective clothing. Thanks for your attention, and I hope I've answered your questions. Good evening.